Poor wireless connection. Oh. Good afternoon and welcome to the first of the NHS Bradford web chats. And this one we're starting, as it's the start of 2007, with a New Year, New You theme. We are all wanting to live longer, and if we want to do that, we need to be investing in our health. We need to be investing in our health both physically and also in our mental health and well-being. And this is a great time of year for us to make some new changes, some changes that will make a difference. These should really be small changes. We mustn't be setting ourselves up to fail at this stage, but think about things in your life that you think would make a difference to your health and well-being, and those around you. So if your parents, think about how the changes that you might make, albeit small, will make an impact on your family. So some of the changes that we think we'll talk about are thinking about smoking cessation, alcohol reduction, calorie restriction, improving exercise, also improving sleep pattern, ways to reduce stress, thinking about work-life balance, and spending time for you and with your family. So, as I've said, for those who have joined since I started this is the first of a series of these that we're doing. These will be running once a month, and they will be posted on the Facebook page, and later, if you don't watch it at the time, you can download it later, and we'll also be putting it on the NHS Bradford and Airedale YouTube site. So, as we've said already, we're starting this new year with New Year, New You, and we're thinking of some of the changes that you can be making to improve your health and well-being going forward. Now, if you have any questions that you'd like me to answer, or us to be able to answer after this Facebook session is finished, then please will you start posting them on the website now, and we'll be able to take those as they come in. This is not going to be an opportunity for you to get an alternative GP appointment, I'm afraid. And I have failed to introduce myself. I am Anne Connolly. I'm a GP, currently working at Bradford Healthcare, and I've been the clinical lead for maternity, women's and sexual health for Bradford and Airedale for more years than I care to admit to. Now, looking down some of the available resources that we have to support you in Bradford and Airedale, about how we can help you make these small differences that we're talking about. Firstly, there's a significant amount of information on the NHS Bradford and Airedale website, or if you just Google self-care, Bradford self-care, you can download lots of these resources from the NHS Bradford website or through bradford.gov.uk. The push for this is to make one challenge. Make something that will make a difference to your health and well-being that is achievable. Take control of your health and well-being. If this is going to work, then it's often better to make it if you get your friends involved or your family. Share with them the change that you want to make so that they know that you're committed to make this and you've got their support. If you want, you can make a pledge and put it on our website so that we have made this as your challenge. And as I say, if you Google Self-Care Bradford or Bradford Self-Care, then you can download this and lots of other useful pieces of information. Other opportunities are thinking about, if we're thinking about some of the physical, the health well-being we can improve, thinking about how can you improve if you're a smoker? How can you reduce your cigarette intake? Because we know that reducing smoking or cutting out smoking is not only good for your own health moving forward, but also for those who live with you in your house, or more recently we've seen big publicity about people driving with smoke environments and the impact that has on children. Smoking, the saying in health is that it will age your heart by about 10 years. So you increase your cardiac risk, your heart disease risk, by about 10 years by smoking. And by cutting out the cigarettes, you reduce that risk to normal within a few years. We know that smoking will also exacerbate problems such as asthma. We know smoking causes various cancers. And we know that smoking causes long-term health damage generally. Now, Bradford, you can self-refer yourself to the smoking cessation services, or you can talk to your GP and get the phone number from your GP. We will be putting these numbers on the website, but for those who have a pen and paper available, it is a Bradford number 01274 437700. 01274 437700. So if this year your commitment has been to think about stopping smoking or to already stop smoking, then please take note of this number and use this resource which is freely available for you. Public Health England have recently launched a fantastic resource. If you Google 1U, you can download all the information on the resource on the website, and I have a paper here that explains it to you. On this, you can choose, you go onto the website, take the quiz to start with. Again, we will be putting this resource online so that you can see it. But if you do the quiz, and then after that, if you can pick the points that you feel would most benefit you from your health, and you can download apps, and there is a guideline that will signpost you to local groups, such as ability to do couch to 5K to improve your exercise, or our local park runs, which run in two of our local parks, Lister Park and Horton Park, every Saturday. These are all about making small changes. You don't suddenly have to think that you're going to be able to run a marathon. We know also there are some lovely, great resources around thinking about reducing your calorie intake. In Bradford, we have an increasing problem with obesity and the health concerns of that. Obesity is poor for the heart, it increases heart disease risk. We know it makes people feel worse with their generalised joint pains. We know that people who are obese will have poorer sleep patterns. And we know that it will increase morbidity and mortality. And there are problems with increasing cancers, particularly women's cancers, breast cancer and womb cancer in women who are obese. We know if we can improve the cooking, the dietary intake, and the cooking really from the mother in the family, the woman in the family, then that will have an impact on the rest of the family. In Bradford, we have a significant issue with childhood obesity, particularly with our school-leaving children, our primary school-leaving children, aged 11. And we need to be thinking about how we can improve the diet, reduce the sugar intake of those young children, and also improve their exercise regime. Try and get them away from the television. Try and get them away from their computerised games. And this week, nationally, we've seen the launch of the Change for Life food app. This is particularly aimed at children, for children. And if you Google Change for Life, then you can download the information on here. And this will give you information about the sugar intake of the food you're taking and intaking in your diet, and also the calories. These and other web apps are very useful when you're doing your shopping and knowing what you're buying. So here we have another aid which can be downloaded on the App Store, and this is Let's Be Sugar Smart. We've seen in the press this week about the fact that half of children's sugar intake is taken before they go to school in their breakfast cereal. We need to take these issues seriously, because otherwise we are creating a major problem for Bradford. Bradford, with the obesity problems and also with our dietary intake, we have one of the highest rates of diabetes in the country. And that is having an impact on our health and well-being generally. So, how are we going to start to make a difference? We're going to start to make a difference by making small changes, not trying to refashion the entire way that we live, because if we try and make too big changes too quickly, then we are setting ourselves up to fail, and once we've failed, we'll think we can't achieve, which adds often to the increasing stress that sometimes we experience by knowing we should be doing things better. So we can think about achievable small steps, something that we can financially afford, something that we can reward ourselves with. Sometimes it's about keeping a diary to check, to see if through that day you have done whatever it was you set out to do. And if on some days we fail, then we go back and start again the next day, knowing that the next day is another day. Other resources that are available, thinking more around mental health, we have in Bradford recently launched the Wellbeing College, which was launched by Bradford District Care Trust. Now this can be accessed by phone on 0300 555 5551. 0300 555 5551. Or by putting into the internet www.bemywellbeingcollege.nhs.uk. Now this is a new resource, and it is a fantastic way of looking at parts of our well-being that affect our mood. This might be about anxiety, about sleep, about stress management, and about managing other problems. Through this website you can access a number of resources or be linked into local groups or be made aware of issues that may be more serious and therefore advised to go and see your GP. In all of these, we will improve the care that we provide for ourselves and our families and reduce the impact and reduce the waiting times that we have to find our own, to be able to get GP appointments. So, for those of you who have joined this web chat since I have started, this is the first of a monthly series of these web chats that we will be hosting at NHS Bradford and Airedale. This first one is taking the opportunity to welcome people to 2017, and this is New Year, New You, and it is looking at ways that we can improve our health and well-being by improving our physical health, reducing some of the issues that will compromise our health in the future, such as smoking, obesity management, improving exercise, alcohol reduction. But it's also about improving our mental health and well-being and signposting people to self-help resources, and there are many that have been recently started both nationally through Public Health England, through the NHS, and also locally being found on Bradford Gov website or NHS Bradford. Now, one last point is about how we can other ways to improve our health and well-being, and that is to take up the offer of screening and immunisations. We know that there are some conditions that if we prepare for and we find out early that the problem is starting, then we can do something treatable to prevent the problem from progressing. One of those is about having a blood pressure check. Heart disease is not recognised until the event has caused significant damage, such as a heart attack, a stroke, or maybe problems with causing cramps in the legs when walking. So, by identifying the problem early, going into your chemist, your pharmacy, or by going to your GP, the nurse appointment, you can have your blood pressure checked early, and if problems are starting, then advice about exercise, weight reduction, salt restriction, all of those things can be started early to prevent the problem becoming more significant. The NHS also has a number of screening programmes. Cervical screening will reduce the prevalence and deaths caused by cervical cancer. All women should attend their cervical screening appointments, which are offered between the age of 25 and 50 on a 3-yearly basis, and then providing things are fine, between 50 and 65 on a 5-yearly basis. Many women find that in their busy lives they put off their opportunity to go and have their cervical screening. So maybe this is the time, new year, new you, to go and make an appointment at your GP to have your cervical smear done. And if you don't know whether you've missed your appointment, contact your GP surgery to check. Same with breast screening. Mammography is a breast examination that all women are invited to on a 3-yearly basis once they hit the year of 50. If you haven't attended your screening or you're not sure, contact your GP and they can put you in touch with the relevant sources to find out whether you should go or send you a further appointment. Bowel screening, once you hit the age of 65, you will be sent a pack to do your bowel screening. If you haven't done this or you think that you are due, please will you contact your GP so that you can find out how and when this should be done. This is a simple test. It's a matter of providing stool samples in the kits provided, and it will pick up early signs of bowel cancer, which is one of the biggest causes of death from cancer still in the UK. Finally, immunisations is an important point. And if you've had children who aren't up to date with their childhood illness immunisations, such as measles, mumps, German measles, polio vaccines, tetanus, then please will you contact your GP to see if your child is already immunised, and if they are not, then will you please contact and make an appointment to take your child along to get the immunisations to prevent them getting some serious illnesses such as measles, which will still kill occasionally in the UK. And obviously meningitis is something that's recently been added to the regime, which again is a significant problem for us still in the UK. Flu immunisations, if you have COPD, heart disease, asthma, or any other long-term diabetes, or you've been called for your flu immunisation. Obviously pregnant women should have attended for their flu immunisation, and our young children. If you were called and did not attend, there is still an opportunity, as we know, that the flu epidemic is still, or significant amounts of flu are still around, and preventing flu is better than waiting until you get it. So, just capping over what we've said already, this is new year, new you. It's a time to think about your health. It's a time to think about your health going forwards, because actually we want to live well and we want to live longer. And to do that, we need to be keeping us as healthy and strong as we can at this stage. And that is by thinking about simple steps and how we can help. So smoking cessation, good resources in Bradford. We will be posting these on the website. Alcohol restriction, thinking about a healthy diet, healthy exercise regimes, how that impacts you and your family, and how we can improve the health of all of us moving forward. Mental health wellbeing, there's the great new resource, www.bmywellbeingcollegE.nhs.uk, so that's bemywellbeingcollege.nhs.uk. Simple resources to be using about sleep, stress, anxiety, and other issues that might be affecting our mental well-being. And then finally, there's things about prevention. So it's about making sure we're up to date with our screening, be it cervical screening, breast screening, bowel screening, aortic aneurysm screening in men, and having ourselves immunised against some of the preventable illnesses. So the children's immunisations, measles, mumps, strabs, rubella, meningitis, flu, pneumococcus, and our travel immunisations if we are about to go travelling. There are lots of self-help resources in Bradford. There is a series of self-help resources. Google Self-Care Bradford, Bradford Self-Care, sorry, and you can download some of these which are about living well with chronic conditions, and there's this one on asthma, there's one on heart failure, there's others, there's having a medicine cabinet for winter, well actually it ought to be all year, which makes sure that at home you've got things like paracetamol, aspirin, plasters, bandages, and whatever else we're recommended to keep at home. It also, on the Self-Care Forum, has a list of how long we can expect to be unwell if we have some of these minor illnesses, ear infection. Instead of running to the GP or to A&E after a day or 2 days, then we know that actually the normal time period might be up to 4 days and a cold maybe up to a week and a half. Lots of self-care. Further information like this can be provided by your pharmacist rather than having to struggle to try and get a GP appointment. Now, this is the end of our first of these webcam discussions. We will be hosting more of these. The next one is planned for Friday the 3rd of February. We will be starting at the slightly earlier time of 12 o'clock. If you have any questions or any thoughts about this particular webcast that you'd like to post on the NHS Bradford Facebook page, then please feel free. This obviously goes out to the public, so I won't be doing individual consultations, but if there are issues that we've discussed that you feel you'd like to comment on or like further information on, then we can obviously write down some of the contact details and signpost as we've said. The next webcast will be talking about breaking the taboos. We're going to be thinking about some of those health topics that are important but we don't always talk about. So this is 2017, new year, new you, time to make a difference. But make it something that you can achieve at. Don't set yourself up to fail. Thank you for listening.